Welcome back. Now for the news in detail. There is mixed reaction among local insurance agencies over the September 1st implementation of the mandatory National Health Insurance NHI program. NHI is geared to provide financial support for the legally resident population of the BVI to meet the cost of treatment in times of illness and injury. However, members of the Insurance Association of the BVI have raised concerns about the future of the private medical insurance landscape in the territory. IABVI circulated a press release to their members and the customers, raising concerns in the interest of their members. IABVI is asking many pertinent questions. One asked the following: since children born in the BVI by non-belongers or non-residents will not be considered a BVI resident, the mothers would usually prefer to go to nearby islands like Puerto Rico or return to their country of residence for delivery. How will NHI handle this situation? Will they still be able to avail the maternity benefits, since it is stated in the policy schedule that there will be no overseas maternity coverage? Apart from the many questions posited by the Local Insurance Association, they say that local insurances currently insure approximately 62% of the BVI population, which stands around 28,280 persons based on population data from the Ministry of Health and Social Development. The release also says there are approximately 17,600 persons insured by insurance firms and through agents and brokers in BVI. IABVI argues that based on the average health insurance premiums across the territory, the cost between the employer and employee for NHI is generally more expensive than the cost of private health insurance. However, the association says this does not take into account the cost of paying for non-working spouses or dependents in a household, which they further estimate will increase the cost of NHI. The IABVI also believes that there are 18,000 residents who will be eligible to pay NHI based on an average salary of $40,000 per annum. The release further states that should there be a 100% compliance of collection, NHI would collect $54 million each year. Similar to one's Social Security contribution, NHI membership is fixed at 7.5% of income. Contributions to NHI will be shared on a 50-50 basis between employers and employees. Self-employed persons will be required to contribute the full percentage of gross earnings as they serve as both employee and employer. The registration process runs from September 1st to December 31st, while contributions take effect January 1st, 2016.